Welcome to The Brew. Today we are with somebody whose story is so inspiring, words fall short. In an age when people would say no to people to give food to somebody who had COVID, to shun people out, this particular lady decided to walk out and help people. And in a Yaris. Interesting, right? Let's find out more. Welcome, story. How did this all start?
Actually, when the COVID started, our health center turns to COVID center. So we all are worried and we are all afraid because we are also too much healthcare workers also too much scared of these conditions and this pandemic situation. So that time, then we were in full first experience like that. We are in full PP covering and we are not eating from there and you're using any clothes there and very difficult to come back to home also. And patients is thinking that something is going to happen them because what is going around there every day they used to see. So they are too much worried. So in that case, as they don't want to go home and they are asking sister whether we can stay here or somewhere like that, we are afraid to go back. In that situation came that time, I thought only working in this COVID center won't make any difference. I have to come outside the society. I have to help for the people, especially low income workers, because they don't have anybody to because they don't know the protocols of Dubai. They don't know we are in safe hand, and they don't know what are the services Dubai government is actually we are getting we were in safe hand, really we were in safe hand, and we are getting, I think no any country will give such a security and such a treatment for the patients irrespective of their nationality, irrespective of their race, irrespective of their income, means those who are rich or poor. It is not like that. Dubai Health Authority, what they did, they took all the patients. They are not giving to any private, they are not sending to any private here and there. They are take the responsibility for the all the patients, those who are affecting the COVID-19. So this one I want to tell, they are unaware of that. And this one I want to inform to the people, because they lost their job. Most of them, they are in construction work and they don't have salary and they don't know where they have to go. Nothing, they don't know anything. Or to give the awareness, I came down to this society. But when I reached there, I came to know like that they need not only the psychological support, they need more and more.
Yeah, that's true.
So in that time, COVID taxi is there for the COVID positive patients, and the PCR those who want to do, and it is very difficult for them to go up to there because taxi they have to pay money. Even sometimes 80 dirhams, 90 dirhams, which is too much. Heck, means too much because they don't have salary. So what I do after finishing work, I will tell them to, okay, you stay there. I will come and collect you. Then I will drop them in the health center. Then another trip I will go. Then that time this one will finish. Then I promised them, you don't worry, you go to home and stay there. If anything is there, you call me. I will come at that 24 hours. My service is available. Then I started to give my number. Then it spread like I don't know, within weeks. They are calling system. This one is gone. You have to come like this. Right. So I will go there. Then so many patients, those who are in the home quarantine, I took them to hospital. I got one day 78% saturation and 62% of saturation. My car only, I took them to the hospital. Many patients I took them, but the 2-3 serious cases I was taken them to hospital. Everybody was shouted at me that time because
it's a big risk.
Yeah, big risk. If anything will happen. So my husband, he said, no problem. Big risk means what will happen? We have to go back. That's it. So anyway, if you will do that, means one family. And how many people are there? My husband, he's because of him only, I'm sitting in front of you now, because lockdown time also, he was supporting me like financially. financially he was supporting. Like we started to buy food. They don't have food, so we started to buy food from at that time 8 dirhams, I think. No, 8 dirhams per meal we used to get. Then we came to know it is costly. Then he went to Ajman, and wholesale market is there. He brought the rice and some chicken, and we bought that one. And when I will go to the duty, he will make this one and he will pack. And we will not put onion and this one and not that much. He will just put the masalas and he will make and he will pack. Sometimes 100, 125, 140, 440. One day where he gave me 140. My son also was there. Then these three, they will make packing and they are giving, because they cannot go outside because lockdown is there. And my car I can take outside because I am a frontline warrior, so it's free. Camera is ticking, but I'm not worried because it's free. Then so many stories are there, and I don't know.
So you're like the modern day Nightingale, like, and you have a full backing from your family. And
yeah, because of course, because night I will come after finishing duty, I will go directly to the society. Then from there, sometimes like 12 o'clock, 11 o'clock also I came back. Then when I'll come here, and that time somebody will call. And mostly those who are staying in with the watch, Sharjah, they are putting the watch. No, they cannot go outside at all. So they don't have food, and their house is like a containment zone like that. Nobody will go. No security will go, and they have money, but they don't have source to get the things. So I'll go. Night, my husband for the security purpose. My daughter will be alone here, and we will make her. Always she is telling that, she will sleep over here. We will go, and when she started to cry, he will come back and he will confirm that whether I am safe or not, like that. Yeah, night we are going, no, like this. So he supported. He was encouraging me. He said, I can go, but I don't know anything about medically.
That's true.
Then you are the person.
You are the nurse.
You have to go like that.
So tell us, what were you thinking mentally? Like, what were you going through mentally while all of
starting time, it was very hectic for me, because I was also a patient before in the childhood. So I know what is the problems. Patients means what, and how they are mental status. That I know. That's why I thought, okay, I will go and support them. That only. Then I involved in the society. So I came like that. They need food, they need transportation, they need hospitalization. They need those who want to go back, no, because no salary, and 60 years old laborers, they are here, and
no job.
5 years, 6 years they didn't go to the home country. Like this. So they were also crying. So then we had to arrange fund for them to get the ticket, and some of them they helped for the chartered flight and all. They started. They helped us also. Then like that, I went stepped out. And then many people in contacts, and then finally I reached to the associations to association. Everybody helped me.
They all joined in forces with you. And
me. Now I am the member of so many. This one.
So you must have met a lot of laborers during this time. Have you kept in touch with anybody?
Yeah, everybody. But actually they cannot help me for this, for the social media and all. They cannot help me to give the voting. And last time I went to the labor camp for the food distribution. All came to me and they took the selfie with me. Yeah, that video I have. Yeah, that one I sent to Aster Guardian also. Yeah, like that.
Since you brought it up, this award.
Yeah, and many of them, not only the labor class, many of the high class family people also, I help them. Now what people are doing, even they are having a normal any problem, like any disease is there, they are going to the doctor and they are sending me, this medicine is okay.
So you're their second opinion.
Yesterday also they sent the lab reports.
Can you please check?
Yeah, please check.
So you become their official second opinion.
That much trust is there.
That's how much of trust you've built, over this period of time, and all of the
Yeah, too much. Like they never says like that. I'm a nurse. They never say like that. So they are calling me as a daughter, and I'm become their daughter,
Became a
and
relationship.
yeah, like cousin, friend, brother. Even not only people from Kerala, even Pakistans, even other nationality, all. It is like that.
So talk us through this award. It's definitely an honor, but what was your initial reaction when you heard that you've been nominated for this?
Actually, really, I'm surprised. Really. And like, my patients only brought me in this award. My
That's
patient only nominated me for this. And she was insisted me like, you do. I said, no, this is the international level, not for you people to play like this. This is a big award. So,
but what you did was nothing short of brave and
no, actually, this is all. Just now, I am remembering the people, recollecting, and everything is now. But we forget everything. We did it and forget everything. Who knows? This and all
it
happens.
was all about the service for you. It was not about
Yeah.
anything else.
Yeah, that's why.
You're the true modern day Nightingale. Truly.
Thank you. It's because of my family, of course.
Absolutely.
Yeah.
Absolutely.
If they
Any
are,
message you'd like to give any nursing students out there or anybody in the healthcare field?
yeah, actually, they should love their profession and uh, good communication with the patients. And when they are saying something, you should be keen observation will be there, and we should be with the patients like we are the family member of that person, or like empathetic. It happens to us, and always compassionate with others.
So I'm sure many people would love to vote for you. So where can they go to vote for you and get you to win this award that you truly deserve? Tell our viewers.
If they can go to Aster Guardian's website, in that it is there.
They can vote there.
Yeah, what in that everybody's all 10 candidates, this history, everything is there in the website. So in that, if you will go, if they
So
can
as a
select.
thank you for her service, you can vote for her on the Aster Guardian website. Thank you.
My name is Ishel. Mama always used to do a lot of good things and go outside to give lots of things. And the only thing that made me a little upset was that Mama, she left me home alone. She would like send me somewhere and go. So, but now I don't think that's such a bad thing. I now realize that she is doing something good for others and it's not that bad.